Okay, looks like we're finally ready to go. Welcome all to the webinar. I'm Dr. Hashimoto, and today we're going to be talking about how to eliminate your neck, back, shoulder, hip, knee, ankle, or simply treat your rheumatoid arthritis, Hashimoto's thyroiditis, Parkinson's, multiple sclerosis, and other diseases using stem cell therapy without all the side effects from risky medication or surgery with no guarantees.
I had back pain for 22 years. It was a way of life. I decided to do the stem cell procedure and my life changed overnight. I got out of bed by myself, I was walking again, and no more pain pills.
So that's Bonnie. Bonnie's history is that, yeah, she did have back pain for 22 years. She did have a back surgery. She did epidurals. She burned the nerve. She did physical therapy. She did acupuncture. She did chiropractic. She did everything under the sun. She was living in pain pills, and always had a pain management doctor to work with. She wasn't really that good of a candidate for another surgery, and she couldn't sleep throughout the night without rolling over or getting up because of the pain. She loved to walk, and she wasn't really walking that much anymore because of the pain. And that's when one other doctor referred her to our clinic for stem cell therapy. See, the reason why she was having pain is because the doctors told her that she had a lot of back arthritis and just worn out joints. So basically, the cushion's worn out. She was getting down to the bone, and that's why she was having all her pain. So with the stem cells, we were able to grow some cartilage, and that got rid of her pain, and that's how she was able to get out of pain almost immediately.
I have had 3 total joint procedures, and I didn't want to have another one. That's when a friend of mine told me that I should try stem cell research, so I did it. And let me tell you, it was the best decision of my life. I can now do all the things that I used to. I can play golf again, and I feel 25 years younger, and I highly recommend it.
I'm Dr. Olasnicki.
And I'm Dr. Hashimoto.
Call the number below to see if stem cells can change your life.
That's Robert Colbert. He's an actor in Hollywood and different movies, different soaps, very popular on some popular soap shows. And he heard about stem cells from one of our other patients that received it, and he drove out from Malibu to get the procedure done. Long story short, he had a couple of falls some years back, had 2 really arthritic shoulders, told him he needed 2 shoulder replacements. That would require 2 years off golf, 1 year for each one. He wasn't ready to commit to that at his age, and that's when he decided to do stem cells. So for him, he was sleeping without pain, moving his arms around, raising his arms overhead, and feeling much better. So for him, he was looking for an improved quality of life without any downtime. And that's why he chose to do stem cells. So here's our practice. This is Dr. Olasnicki, myself, Dr. Hashimoto, Andy Lovato, physician assistant. Why should you listen to us? We do have quite a bit of experience. Dr. O probably has the most. He's been involved in stem cell research since the early 90s. He got involved when he was in grad school at Columbia, and he really liked it. Both of his parents are physicians, and they convinced him to not pursue research and go into medicine. And so he decided to give up on his passion of research and go into medicine. And basically, as soon as stem cells were available to physicians in California, that's when he jumped on board. So we've been doing it for a while. He would be kind of a pioneer in the field. He's also a consultant for a $1 billion company called Targezyme. They do organ transplants, and he's consulting with them as far as using stem cells to reduce the rate of organ transplant rejection. He also co-authored the stem cell book with myself, Demystifying Stem Cells, which I'll tell you how to get for free at the very end of this. We've performed more procedures than any other physical medicine or rehabilitation practice in the Coachella Valley, more than all of them combined. Orthopedics is kind of our specialty. We've done a variety of other conditions, but basically low back, hip, knee, shoulder, neck. That makes up the bulk of our practice. We do tendons, we do ligaments, but we also do autoimmune conditions and post-stroke because they're a fairly simple procedure to do. We also offer regenerative laser treatments or infrared light treatments post-op to accelerate the growth of the stem cells. If you're out of state or live far away, we usually recommend the infrared light therapy, and that just helps the stem cells grow faster. And then if you're relatively local, then we'll recommend using a laser therapy. Laser therapy is something that cannot be sold to patients for the one that we use. So this is... it's a great device, but obviously if you're out of state or out of the area, it doesn't really make sense. And then, yes, we wrote a book. As far as getting into the webinar, as I move forward, I highly encourage you to type your comments and questions into the chat box below. There is no such thing as a dumb question. No such thing as a dumb question. So just ask your questions because I guarantee you someone else is probably thinking that. So this information is for you if you're currently suffering from joint pain and do not want to undergo surgery. This information is for you if you've had a previous joint problem and don't want it to turn into chronic pain and a surgery. This information is for you if you have an autoimmune disease and just want to turn back the hands of time and slow down the progression of your disease. This information is for you if you suffer from a neurological disease, stroke, brain injury, or dementia. And this information is for you if you just want a better quality of life, don't want another surgery, don't want to get held back, you want to travel, and you don't want to be a burden on your family. I have so many patients that come in, the husbands that are suffering chronic pain, and their wives are developing back, shoulder, and hip injuries because they're helping move around their husbands who are about 50 to 70 pounds heavier than they are. So if you're the spouse or the wife or the husband, this information is also for you. So today you're going to discover how regenerative stem cells could eliminate your joint and muscle pain so you could avoid surgery. You're going to learn why not all stem cells are created equal. You're going to learn about cost-effective growth factors and why they're not the same as stem cells. You're going to learn why physical therapy, laser, infrared lights, and diet play a large role in your stem cell treatment outcomes. Why this information is important to you? Well, most doctors do not understand the full benefits of stem cells, and that won't happen for about another 10 to 15 years. I find that the physicians that know the most about stem cells usually either practice stem cell therapy or they've been researching it themselves for a friend or a family member or themselves. We've treated a number of physicians because they didn't want to go under the knife and they were looking for an alternative to surgery, or they suffered from an autoimmune condition or multiple sclerosis and they were just looking for alternatives. They understood that it is a very low-risk procedure and it is extremely safe, and that's where most of the research is right now. It's based on the safety data. Most do not understand that adult stem cells work just as well as fetal stem cells, so you don't have to worry about aborted fetuses, so there's no moral or ethical issues when it comes to stem cells anymore. Most do not realize that stem cells work for autoimmune conditions and neurological conditions just as well as orthopedic joint injuries. So I have a disclaimer to make. Stem cells are not the answer for all conditions, but we're just beginning to learn the benefits of this amazing treatment. This is about as close to the fountain of youth you could get. We've treated a number of different conditions that we did not know it would benefit. There's a number of autoimmune conditions that we're just learning would benefit from stem cell therapy. Basically, if you have an autoimmune condition, it will benefit the orthopedic area, rotator cuff, labrum, tendon, ligament, cartilage, joint. That's where most of the treatments have been done thus far. So let me just tell you how we started treating patients with stem cells. First of all, I was a little frustrated with some of the options available for some of my patients. A lot of orthopedic patients don't realize how many patients fear surgery. They think it's easy because they do it all day long, but everyone has a relative or a family member that had a complication. I have patients that went in for a routine knee replacement and cracked the basically cracked the bone, led to multiple revisions, 4 or 5 surgeries, chronic pain, and I don't care how much research you showed them, they're not going to get surgery on the other knee. Or if it was a family member of that person, they're just going to avoid surgery like the plague. And we have those stories happen over and over again. So they need an alternative because they just aren't willing to go under the knife. In our practice, we used acupuncture, chiropractic, physical therapy, pain management, medications, cortisone injections, epidurals, and they can help people a lot, but there's only so much you could do. If you're suffering from a worn out joint that's getting worn out, eventually surgery is going to be your only option. And if you don't want to go down that road, we need an alternative, and that's why we're offering stem cells. So that's when Dr. O added stem cells into our practice, and we've been running with it for many moons to come, and we're one of the pioneers in this field. So why stem cells over surgery? Well, obviously, worst case scenario, you have death and paralysis. Some are worse off where it didn't work for them. Some people will have severed or stretched nerves. Some people will have cracked bones. Some people will have blood clots. Some people will just simply have an infection. Some people will have allergy to components. Some people have scar tissue. And there's other risks that go with joint replacement or major surgery. And many do not have 100% pain relief. There's a lot of patients that go into surgery and they just aren't really that much better off when they get out.
Okay, so before I had stem cells, it's been years and years and years of pain and inability to walk, inability to, I work and everything, but I was using a walker at this point to even be able to go into work. Very difficult getting out of a chair. It's, for those who have knee problems, you know what I'm talking about. Even just if you sit for 5 minutes, you're so stiff, you just can barely move, and it's pretty horrible, actually, way to live. Excuse me. So I was told that I needed both of my knees replaced, and that stem cells, I was way too far gone for stem cells, way too far gone, and that wouldn't work for me. And that was in San Diego, but and the doctors were great doctors, no question, but they just really didn't want me to spend the money to work on that if they didn't think it was going to work. And I thought to myself, no, it's got to be I got to try this first. This is much better than getting both of your knees fully replaced. It just got to be better than that. God brought me here as far as I'm concerned, but because I was driving around in the parking lot, so I saw this place. I go, oh my gosh, it's like an oasis. And just decided to call and get some information on the stem cells. And everybody here was so friendly and so inviting and warm, and I got a lot of information as well off of their. So finally, I did it, and it was just amazing. The results have been amazing. The first afternoon that I did it, I was better. I mean, I could feel the difference, and I thought, well, maybe it's just mind over matter, but it wasn't. It's kind of like the feeling that I'm getting from this. I can get out of a chair now after sitting for 5-10 minutes. I can get out of the car after being in it for an hour without any pain. I'm still pretty weak muscularly, but I don't have the pain. The pain's just not. I can't. I could cry if it's like because I've been like this for so long, decades, and in one form or another, just really have been struggling with this for a very long time. So, I mean, it's a miracle to me, science to them. But I cannot tell you if you're sitting on the edge trying to think of whether you should do it, don't even think about it, just come do it, because you just don't have any idea how much better you're going to feel. And nobody can guarantee the results for everybody, and I understand that, but they told me I was too far gone to even try this, and it would be a waste of money, and it was the best money I've ever spent, ever.
Robin's story is very heartwarming. She was suffering in pain, beginning to be depressed about her chronic pain. They suggested 2 total knee replacements. She was overweight, and they suggested that she lose weight before the surgery. because she couldn't move around for exercise, she had difficulty losing weight, and she was only gaining weight. And, we weren't 100% sure if we could help her with one treatment. Informed her that, odds are it may be even two. And she was out of pain very quickly and moving around. And as she was moving around, she began to start losing weight because she was able to get some exercise. And it dramatically changed the quality of her life, and she didn't feel like a prisoner anymore. Didn't have to use a scooter anymore, and the walker was getting put away, and she was starting to move around. So Robin had severe end-stage bone-on-bone arthritis and was close to 500 pounds when she started with us, and she's lost a lot of weight, and her pain's gone now. So let's go over our 5 pillars of pain relief. First of all, we have to come up with a correct diagnosis to recommend the right type of stem cell. And yes, we use different types of stem cells for different conditions. We then look at the regenerative medicine and repair and inflammation reduction. Then we talk about the proper deployment of the stem cells in the correct area. Then we discuss structural alignment, and then stabilization. Correct diagnosis. Well, this is House, Dr. House from the show. But yeah, correct diagnosis, correct treatment. So let's take back pain, for example, since that's a very common condition we treat. So if you come into our office for back pain, we need to determine if it's coming from these guys called the facets. And this is very common. These are patients that will have back pain. It's a dull ache. It sometimes will be dull diffuse down the hip or the leg, but it's usually across the low back. And, when you go to sleep, when you're curled up like this and you go to straighten up in the morning, you usually feel like really stiff, and it takes you a little bit to straighten up, but you can sit down for a period of time. That oftentimes can be facets, easily diagnosed on a CT, also on an X-ray, and also on an MRI. This is a common one, degenerative disc disease. This is a very common type of back pain that we have in our office. We have piriformis syndrome. That's another cause of back pain that we see in our office. That's where this muscle gets really tight around this sciatic nerve. Some people have bulging discs. This is a common one, and that disc will push on a nerve. Basically, you're going to inject to the disc and get that disc bulge to heal up. Some people suffer from spinal stenosis, and sometimes it's from disc material pushing in here, and that can be treated with stem cells. Sometimes it's bony growth of arthritis, and that cannot. This, we have to look at a CT or an MRI to determine if you're a candidate. I pretty much guarantee that close to 100% of you that have back pain will have something called lower cross syndrome. A lot of people that come to our office have done physical therapy. They said it didn't help. And the physical therapy is going to work on these combination of weak muscles in the abdominals and the glutes, tight muscles in the back, and the hip flexor. But if you're suffering from chronic arthritis, a disc bulge, stenosis, and that cartilage between the joints is just kind of wearing down and getting really thin, you could do exercises till the cows come home, and we're not going to address the pain. There's also sacroiliac pain. This is something diagnosed usually on an exam and a talking to the patient. It doesn't show up on an MRI, X-ray, or CT until kind of late stages. These are patients that will have pain with sitting for long times, usually in a soft, deep chair, and then they go from a sitting to standing. That's when they get the most discomfort, and it's going to be in the back of the hip. Oftentimes they'll come in, get x-rays on their hip. They may have no hip arthritis, and it's really just coming from pelvic pain. So, like I said, back pain can have a lot of different causes. So we need to determine the cause of your back pain to determine what type of stem cell and where we're going to put it. And that's where we're alluding to pillar number 2, the regenerative medicine approach. So I talked about a lot of different types of back pain, and I was trying to make a point there. But they all have one thing in common, and that is inflammation. Now, how many of you guys have heard of inflammation before? Usually I say raise your hands, but we're on a webinar. Let's see. Okay, we've all heard of inflammation. Does anyone out there know what it is? Okay, no takers on this one. Well, we need some inflammation to survive, but most of us have too much inflammation. So you could have inflammation on your blood test, inflammation in your joints. You might see a physical therapist, pain management, orthopedist, and they just say you have too much inflammation. But what is it? So I always like to give take-home experiments. So if you want to do a take-home experiment, you could dig out your barbecue brush with the metal wire brush for your barbecue and dig it out. And then just start rubbing it back and forth against your skin. And after a few minutes, your skin's going to become red, raw, and inflamed. So how many of you out there want to try that? I guess no takers, and I really don't want you to try that, but that's a perfect example of what inflammation is. So if your doctor tells you you have too much inflammation in your wrists, in your spine, in your hip, in your knees, think of it as someone with a bunch of little metal wire brushes that rubbing it back and forth inside your joints, inside your tendons, inside your ligaments. If your cardiologist or primary care says that you have too much inflammation on your blood test, that means you have these little guys running inside your arteries, getting your heart, your arteries, and your veins red, raw, and inflamed. So inflammation, when you look at it this way, can be painful. So your doctor wants to help you, so they want you to reduce your inflammation. So you tell your doc, it's like, "Doc, my back hurts after I go golfing." And he says, "Oh, well, you have too much inflammation, Mr. Jones. Take some of these non-steroidal anti-inflammatories such as Aleve, ibuprofen, or Motrin, and you'll feel better." And now that is true. However, if your back pain is really coming from chronic arthritis, a chronic disc bulge, or say shoulder pain is coming from a chronic rotator cuff tear, your knee hurts from a chronic meniscus, you need to take care of the solution. Think of it as if you got a pebble in your shoe, that's a physical problem. And we could prescribe you Pebblese all day long, and sure, your heel might feel better, but eventually you're going to feel that pebble again in your heel. So we need to address the solution, the cause of your problem. And your doctor never tells you when you can stop taking these medications. And the answer is never. So, and then, just as a side note, as far as these medications go, over-the-counter anti-inflammatories, there's 16,500 people a year in the U.S. that die from over-the-counter anti-inflammatories, and it's the number one cause of kidney failure in the U.S., and over 103,000 people a year get hospitalized from over-the-counter anti-inflammatories. So these things, I'm not saying that we never prescribe these things, but they're never meant to be taken long-term. And a lot of people think that just because they're over-the-counter, they could take them all the time, and you can't. So what if you could repair your joints so you don't get inflamed and they're not painful anymore? Well, what would Dr. McCoy offer you? How many of you guys out there watch Star Trek? Couple. Guess I'm the only nerd over here. So Bones over here, Dr. McCoy, well, first of all, he would shine a fancy laser beam over this arthritic joint and he would just repair it. But if Dr. McCoy was talking to you about arthritic joints, he would first talk to you about a piece of lumber. And if you bought a piece of wood at Home Depot and you left it outside for maybe a year, year and a half, eventually that piece of wood is going to start to rot. So how many of you out there have heard of the word arthritis before? Obviously. Now, how many of you have heard the word joint decay or degenerative joint disease or degenerative disc disease? Now, how many of you knew that arthritis was the same thing? Arthritis is a general umbrella term for all of it. So it's like a rotten piece of wood. So this new piece of board that gets left outside starts to decay. And the reason why they call it joint decay, degenerative joint disease, degenerative disc disease, facet arthritis, it's all the same thing. That joint cartilage, it just begins to kind of rot away. And that's what the joint essentially looks like. So what would Dr. McCoy offer you? Well, the first thing he would probably talk to you about is growth factors, something known as platelet rich protein, which would be a very common one that's been around for a couple of decades, about 10 years in orthopedics. This is where you take a simple blood draw, spin it down in a centrifuge, and you're going to take this platelet rich plasma and you're going to deploy it into a joint, tendon, ligament, or muscle. And it's going to release a lot of growth factors in the tissue. And it causes an inflammatory response. This is a good inflammatory response, and it just starts the healing cycle. And the theory on how this works is that you're injecting it into an arthritic joint, and it lays down a fibrous layer of scar, and eventually it acts as an artificial cushion. Now, it's not going to be true cartilage, so eventually you wear through it, but it does last for a significant amount of time. We have a lot of people that get 12 to 18 months out of a treatment. So this is a very good alternative for patients, especially if they're under the age of 40.
Hi, I'm Pam. I've been seeing Dr. Hashimoto now for about 9 months. Before I came to him, I've been experiencing chronic back pain and neck pain for probably 4 or 5 years. After several treatments with Dr. Hashimoto, I received a PRP. Once I received that PRP, it was a couple weeks before I felt total relief, and it's been 9 months and I'm feeling great.
So that's Pam. She came into our office. She had chronic back pain. She was doing physical therapy, chiropractic. Had felt good when she had treatments, but the treatments just wouldn't last. And if she sat down on an airplane for 2.5 hours, or went on a 2-hour drive, or sat down for dinner or a theater show for too long, she'd always develop this hip pain. And she always said, like, her hip and back would always go out of alignment. And it turned out that she just really had a hypermobile pelvis. The ligament was stretched and damaged from an old injury, and she had too much hypermobility. So we just took this platelet rich protein, injected it into her pelvis, created a layer of scar around her ligaments, and it tightened it up. And what that did is it gave her pelvis stability, and it kept it from pinching on the nerve. Hence, her back pain was gone, and it's been gone for close to 9 months. And I believe it was still gone a year later. So most of the people are about 12 to 18 months with this. So now we're here to the part that you came here for. So we got embryonic stem cells and mesenchymal stem cells. So embryonic stem cells are the kind that come from fetuses. They're the kind that you have to go to another country for. Germany, Russia, Mexico. You're paying a fortune for that, and it also comes from aborted fetuses. So depending on where you lie on that, since having children, my view of thinking on this issue has changed dramatically. So I have more philosophical issues against it than for it. But fortunately, we have adult stem cells over here called mesenchymal stem cells, and they could turn into all types of tissues. So a lot of people ask me, is like, well, why is there such a big buzz about stem cells? And the stem cell is a cell that you started out in life with. A long time ago, your mom and dad got together and they had a couple glasses of wine. They had 23 chromosomes from each, and they donated them together to make one tiny cell. And that tiny cell turned into your eyes, your brain, your spine, your heart, your liver, your lungs, your kidneys, your legs, your skin, everything. That one tiny cell turned into everything. So the stem cell is like the ultimate construction worker that could build any type of tissue. That's pretty much it. And that's why there's a huge buzz about them. So if you have a need for meniscus, rotator cuff, cartilage, disc, tendon, ligament, heart, nerve, brain, those stem cells can regenerate and repair that. And it's been proven so in animal studies and also in some human studies. So they're actually researching this quite a bit. And about like 20 to 50 years from now, they're going to have a lot more data on this type of procedure. But the one thing we do know is that it's extremely safe. And as long as you get your stem cells from a good source and they're very viable, then you're going to get good results with it if you're a good candidate. And it's up to the stem cell provider to let you know if you are a good candidate or not. And unfortunately, some people out there think everyone's a candidate, when unfortunately not all of you out there are a candidate. So that's why we always have a consultation first. So adult mesenchymal stem cells. They're found all over the body, including the umbilical cord. This is another myth. So there's a lot of people that do umbilical cord only or amniotic fluid, and they're marketing this like it's from the baby, and when in reality it's adult stem cells because it's really coming from the mom. You have bone marrow, which has been around since the late 70s. It's a very common source. And then you have fat. Fat's one of the newer ones. It's been around since 2010. It's a very good source. They've been using it in Asia since I believe 2006, originally on racehorses. And right now, this is the best source out there for stem cells. The only one that's going to have a higher concentration, obviously, is going to be fetal stem cells. But there's no moral, ethical issues. We haven't had any patients complain about taking away some of their fat out of their body. In fact, usually we'll have patients ask to get an extra 20 to 40 ounces taken out, but usually we only take the required amount. So that's a joke. So we got our main sources of adult stem cells. So we got bone marrow. Bone marrow's probably one of the more common ones. It's been around the longest. It's the only kind that we do not use, and I'll tell you why we don't use bone marrow. I'm not anti-bone marrow, it's just that most of our patients are older. So it's a lower concentration, especially in a 50-plus demographic, which is our patient population. You're only going to get about 60 to 600 stem cells per cc, and that's like equivalent of a milliliter. Versus with fat, you're going to get about 1 million to 1.5 million. And that's also known as adipose derived stem cells or stromal vascular fraction. Other sources are going to be the placenta, umbilical cord, cord blood, also Wharton's jelly, and amniotic fluid. So this is kind of a general category. And it's going to be low numbers from most labs. The only reason why it's low numbers from most labs is that the FDA requires a 9-step process to sterilize these. And one of those steps is gamma radiation. And gamma radiation is the cheapest way to sterilize it, but it also kills the DNA of the stem cells. Excuse me. So, it kills the DNA of the stem cells. So, if you kill the DNA of the stem cells, those stem cells are not going to divide over and over again, and you're not going to get that good of a result. Just for example, the umbilical cord and cord blood and placenta stem cells that we get, along with the amniotic fluid, they do not use gamma radiation. They use other means that are more expensive to sterilize it. Also, like even if you look at just the shipping container that we get these products from, it's about triple the cost of their closest competitor, because, if you ship them and they stay in a more frozen and stable temperature state, it's you're not going to kill off and decrease the viability of the stem cells. They also make it to order, so they're not sitting around frozen for months upon months. When you order it, they make it, they freeze it, and then they ship it. Amniotic fluid is a fluid that surrounds the fetus, has a lot of growth factors in it. It also has some stem cells in it. It's very cost effective for some people, and it just depends on the person. It's always a case-by-case basis, so we'll use this with some patients. It's a very low-cost option for people that are not a good candidate for PRP. So this is why we don't use bone marrow. So here's a newborn over here, where you're going to get 1 stem cell per 10,000. Teenager, you're going to get 1 per 100,000. 30 years old, 1 per 250. Like I said, most of our patients are 50 to 95. So this is 1 per 400,000, 1 per 2 million. So if we did bone marrow on a number of patients that we've done in their mid-80s and early 90s, they would have not had great results. The only way to get good results with bone marrow with those older patients is if you send it off to a lab, you expand them in the lab, and you ship it back. And that drives up the cost significantly, because now you've added in a middle person, the lab fee. The procedure is very simple. Basically, you're going to have the person lay down on their side. You're going to numb the area. You're going to just drill in with a little bit of a bone drill, pull out some bone marrow. It's a little bit of a sting, not the end of the world. You're just going to spin it down and usually mix it with a little platelet rich protein, and you're going to deploy it into the joints. And you're going to get a good result as long as the person's young enough. So we have amniotic fluid, placenta, and umbilical cord and Wharton's jelly. So some people are using amniotic fluid and they're calling it stem cell therapy, and unfortunately that's not quite true. And the FTC would not like that statement very much. So when we use the amniotic fluid, we let the patients know that they're paying for growth factors and not stem cells. It does have some stem cells in it, but not enough where we could actually legally tell them that it's they're getting stem cell treatment. So most of the patients will actually use the umbilical cord over here with the cord blood, and that's going to be the richest source over here. And then you have the placenta, and those are going to be two of the richer sources of stem cells. And then they'll usually mix it in with some amniotic fluid. So when we get these from the mothers, this is how the lab will do this. They will actually take it from the baby's side over here, which is immune privileged, and that will not cause an immune reaction, and the cells will not be rejected by the body. Now, that won't kill you, but what it does do is it'll cause an uncomfortable inflammatory reaction after you deploy the cells into the joint. It's going to carry a rich source of growth factors, and we get good results for this. And if you have just one joint that's a problem, this is a very cost-effective option for you. A lot of people ask is like, well, what about the donors? How do we know anything about them? Well, you don't, but the labs do. So most of the donors, these are moms that have already had a C-section in advance. They know they're having a C-section for their second baby, and they've been selected, and essentially they purchase these. So they fill out a questionnaire, make sure that they pass their criteria. The tissues are tested again, so you got everything sorted. So you got your placenta, umbilical cord, amniotic fluid. It's all collected. It's all sterilized. It's all tested. And then it's stored. And then eventually it's shipped to a clinic like ours, and then it's deployed into the patient. The FDA doesn't regulate stem cell therapy, but what they do regulate is certain things like tissue storage. So these companies have to pass a rigorous FDA tissue sterilization and storage process. And this is a 9-step process. So these cells are extremely sterile. So I have some patients that come into our office because we do fat, and they're concerned about the safety issues when it comes with amniotic fluid, placenta, and cord blood. When in fact, these are extremely safe because the FDA, yes, they want this to work for patients, but their number one concern is making sure that the public isn't harmed. So if you have, say, an allograft, which is donor cells, so these are called allograft tissues, if that's deployed into an individual and it transfers a disease like hepatitis or HIV, that would be a big problem. So that's why they require a testing, sterilization, and storage process. So diseases like that are not transferred to people like you. So here's a picture of adipose, patient getting some fat pulled out right here. It's a teeny tiny incision, probably smaller than the tip of my pinky right there, if you could kind of see that right there. It's about 1/2 inch incision, local anesthetic around there, no downtime. We always recommend that we have patients have a driver, but we've had a lot of people drive themselves to the procedure because they didn't have anyone to drive them. That's what 2 ounces of fat looks like. And then after a couple of hours of processing, we're eventually left with stem cells, and we actually get more than that.
My name is Deanna Cherry, and I came into Dr. H about 1.5 years ago because I was having knee problems, shoulder problems, couldn't bend my right knee at all, and I had the stem cell procedure done, and in about 11 to 12 months, I started noticing that my knee was functional again. My shoulders are really a lot better, and I took the nitric oxide, and I did all the things that he told me to do, and I am doing better, and I really would highly recommend it to anyone who's having a lot of pain in the knees, shoulders, and other areas.
That's Deanna. Deanna came in with shoulders and I think hips and knees. She took close to 10 months to feel better. I like to show this one because we always tell patients it may take up to a year. Most of ours are 2 to 6 months. But this was before we were doing laser therapy or the infrared or anodyne light therapy with the patients. And that just really accelerates the growth and proliferation of the stem cells. So she took close to a year, and since those times, we've really changed how we do things. And she's gotten really good results. She's been happy. She just knew that she didn't want to get shoulder surgery, knee surgery, or hip surgery. So she just went ahead and did the stem cells. So she didn't want to wait till she was an absolute cripple. She wanted to start living. She worked hard. And she wanted to maintain her active lifestyle. And that's why she chose to do stem cells. One of the questions that everyone always asks on every single webinar is, does this work for bone-on-bone arthritis? So here is cartilage, the black space. This is bone-on-bone arthritis. This is 4 months later. This thin layer over here is cartilage. And all you need is a thin layer of cartilage to get rid of the pain. So with this, you're going to be able to walk, exercise, jog, and do all the different things that you were able to do when you used to have cartilage. Now we get into the proper deployment of stem cells. So obviously it's an important part, and I'll tell you why here in a second. So IV deployment is the most common one around the world. It's been around the longest. Essentially, you're going to take the stem cells, hook it up to an IV bag, and it's going to drip, and it's going to go into your body. And this is a really good method. It works really well for any autoimmune, a lot of neurological conditions, and overall health and wellness, heart, kidney, lung. And the reason why IV deployment works is because the cells know where to go. And it's not like they have a brain of their own. The cells just float around, and they're looking for a cell signal. And then if you have a site of injury, you're going to have these things called cytokines. And the cytokines are like the guys at the airport waving down the airplane on the landing strip, waving it down, telling the plane to land in that one area. So these cytokine responses getting released at a meniscus, at a rotator cuff, at a disc in your back, in your heart, your brain. It's sending off a signal. And those stem cells just are drawn to that area, and then they attach, and then they start repairing that type of tissue. So this is a study where they actually marked the stem cells with a radioactive dye, and they noticed that after about 7 to 10 days, they started migrating to the site of injury, which is actually really cool. So the next question you might be asking is like, well, if the cells can go to the site of injury, why wouldn't you just do IV stem cells for everything? And that's a really good question, because that probably is going to be the answer for the future. However, at this moment in time, we don't have enough stem cells to do that. The unfortunate part is, if you deploy it through an IV, the cells are just going to circulate and attach themselves to areas of inflammation. So that means if you have inflammation in your liver, your kidneys, your heart, your hip, your knees, your brain, your eyes, it's just going to circulate and attach and start repairing. And now that might seem like a good thing, but if a patient like you came to our office and they came in for back and hip pain, and you still had back and hip pain 6 months later, you're going to be upset and you're going to feel like the treatment failed. So in the future, what's probably going to happen is the cost of expanding these cells in a lab is going to be dramatically lower. And instead of 100 million stem cells, you'd be 100 trillion stem cells. And then you could get away with an IV treatment. And that's probably going to be the wave of the future. If you're coming in with a neurological condition, one of the things that we're doing is we're taking the stem cells and we're actually going to deploy it past the epidural space into the intrathecal space, and it's going to flow right up into the brain through the spinal cord. So it's like an epidural, just a little bit further. So if you're coming in with Parkinson's, multiple sclerosis, that's going to be primary method on how we're going to deploy the cells. So if we want more of it to get into the brain, or even after a stroke, we're going to deploy it into the spine. You can actually do that through an IV, and there's a special solution you could run through before the stem cells that help it get into the brain. But if you want more of it getting into the brain, usually we'll deploy it directly into the spine. If you're coming in with a hip or back or some other kind of joint injury, we're going to usually use ultrasound or fluoroscopy. Most of the time we're going to use ultrasound, but if it's the spine, we use fluoroscopy. Fluoroscopy emits a small amount of radiation. but it gives you a clearer picture. Ultrasound is no radiation, and it gives us a good enough picture for hips, knees, shoulders, ankles, toes. So this is an injection under ultrasound, and then this is an injection under actually CT guidance, and this is a needle making it down to the disc, and this is someone coming in for a disc bulge. Here's a laser. Laser is a great therapy.
Uses a process called photobiomodulation to change the condition of damaged tissue by stimulating cellular metabolism, thereby accelerating the healing process. A large convex treatment head, photons will be scattered, reflected, and absorbed. Lasers operating in the near-infrared spectrum from 650 to 1300 nanometers can penetrate to deep tissue structures. Light that penetrates into the tissue can be absorbed by melanin, hemoglobin, oxyhemoglobin, and water. Energy from these absorption events will be dissipated as heat, generating a soothing warmth in the tissue. The primary target for photobiomodulation is the cytochrome C complex, which is found in the inner membrane of the mitochondria. Cytochrome C is a vital component of the electron transport chain that drives cellular metabolism. As light is absorbed, cytochrome C is stimulated, leading to increased production of ATP, the molecule that facilitates energy transfer within the cell. In addition to ATP, laser stimulation also produces free nitric oxide and reactive oxygen species. Nitric oxide is a powerful vasodilator and an important cellular signaling molecule involved in many physiological processes. Reactive oxygen species have been shown to affect many important physiological signaling pathways, including the inflammatory response. In concert, the production of these signaling molecules has been shown to induce growth factor production, to increase cell proliferation and motility, and to promote extracellular matrix deposition and pro-survival pathways. Outside the cell, nitric oxide signaling drives vasodilation, which improves microcirculation in the damaged tissue, delivering oxygen, vital sugars, proteins, and salts while removing wastes. These mechanisms of action have been proved by over 40 years of laboratory experiments using lasers of minimal power. The recent development of higher power Class 4 systems affords the clinician the ability to efficiently deliver adequate doses of light deep into the tissue to reduce pain, reduce inflammation, and accelerate healing. As you can see in this illustration, the advent of Class 4 lasers makes it possible to not only apply the benefits of photobiomodulation superficially, but to also treat a greatly expanded range of conditions by delivering a clinically effective quantity of photons to cells deep within the tissue.
So that's laser in a nutshell. And obviously, if you're out of the area, we usually recommend anodyne infrared light if that's done for 30 minutes a day. For about 60 to 90 days, you're going to get a very similar results. At the very end, I'll tell you how you could get your laser, your light therapy at no additional charge when you do a procedure at our office. So now let's get into diet. So Deanna was talking about a supplement that help with circulation, the nitric oxide. So we have supplements that help with circulation. Basically, blood carries the nutrition for the stem cells. So you need good, adequate blood flow. Then we're going to talk about diet, and this is basically where your mother was right all along. You need to have a healthy diet, and it's not really a secret. If you're eating a lot of vegetables, some fresh fruit, healthy plant-based fats, and healthy proteins, that's good for food for the stem cells. In the past, some people said that it didn't matter, but at the last conference I was at, there are actually 3 studies being done underway that showed that a healthy plant-based diet increased the viability and the results of the stem cells. Wow, seems kind of crazy. Who thought that a healthy diet would be better than Krispy Kreme donuts? Nothing against Krispy Kreme donuts, but it's just not good food for the stem cells. So a healthy diet will give you better outcomes. Now, I'm not telling you to turn into an absolute vegetarian, but I want you moving more in that direction if you want to get a better result. So if you're coming in for heart disease, like end-stage coronary heart failure, you're probably going to receive more than one treatment, and it's going to probably be closer towards several, 4 to 7, maybe 8, maybe even 10, depending on how bad you are. If you've had an acute heart attack, then you could probably get away with just one treatment. If you have COPD or emphysema, you're probably going to do multiple treatments. If you have chronic end-stage lung disease, then you're probably going to do multiple treatments. So stem cells are great, but oftentimes it's not going to be enough for certain conditions. However, it's the only alternative for some. We've had some patients coming in for end-stage lung disease, and the alternative is feeling like there's an elephant sitting on their chest, or do the treatment and get about a 5 to 10% improvement after each treatment. And they prefer to just keep improving rather than getting worse and dying. Fibromyalgia is a condition that does really well. However, you have to deliver a lot of stem cells and make some kind of a lifestyle change with this. So I've seen some patients, they get stem cell therapy with fibromyalgia, but they did not get enough stem cells. Therefore, they did not get a good result. And that's why with the fibromyalgia, we'll typically use the fat, because you need a lot of stem cells. You're going to get a lot more out of the fat. I'm not saying that we couldn't use umbilical cord and cord blood. It's just going to cost the patient a lot more money because we have to buy it for a third-party vendor. Hashimoto's thyroiditis, and actually all of these autoimmune conditions, will typically recommend using it from the fat. So Hashimoto's is where the immune system attacks the thyroid. Oftentimes, these are people that misdiagnosed oftentimes. They're feeling good, feeling awful. Their thyroid test might come back normal. Their medications are constantly getting adjusted, and they feel like crap. Lupus is another autoimmune condition, scleroderma, rheumatoid arthritis. One of the questions that rheumatoid patients will ask is, well, all my joints hurt. Can I get them in all my joints? And the question is no, or the answer is no. And then usually we just do IV with these patients and maybe pick 1 or 2 joints. But if you have an autoimmune condition, there's a very good chance that you'll do well with this type of treatment. Neurological. Well, ALS is going to be the hardest, but spinal cord injury and brain injury, if you catch them in that 90 to 100-day window, that's when you're going to have your optimal chance of recovery. It's probably going to be close to 100% chance of recovery. If it's been longer than that, which is most of our patients, odds are you're going to end up having more than one treatment. So we have some people coming in, it's 4, 10, 15, 20 years, but the alternative is nothing. So, patients do it, they have improvement, and they're happy with it. Alzheimer's, we have a protocol with that, but usually I will refer you to a colleague, because the better protocol is where you take the stem cells and you're putting them directly into the brain and not even through the spine. So one of our colleagues is a neurosurgeon, and they'll actually put a port into the brain, peel away part of the brain, and lay it into a layer called the omentum. And you're going to get a better result with that. Now, they're going to charge you about 5 to 8 times the price, but it's going to get you a better outcome. Peripheral neuropathy, yes, that's a common thing that we'll treat with stem cells. Patients with neuropathy will do well with this. However, there's a more cost-effective option that we usually recommend for that. You could ask me about that on the phone consultation. Multiple sclerosis also does quite well with this protocol. And then there's also Parkinson's. Parkinson's will do moderately okay. We haven't done a lot of Parkinson's patients, but I know Dr. Olesnicki's uncle gets a treatment once a year with stem cells, and he gets a good enough result to keep doing it. Basically, that's a condition where you have the shakes, you have a medication that helps reduce those shakes, and what happens is the patients will build up a tolerance to that levocarbidopa. So his uncle is maxed out on the medications. There's nothing that medical science could do for him. So he's just doing stem cells to improve his quality of life. And who knows, maybe that might buy him enough time where they might find a cure, or it's just going to give him a better quality of life while he's here on this planet. And, like I know Dr. O would like to keep him moving along, and maybe he'll die from old age and not from his Parkinson's, and that would be an ideal scenario rather than suffering with a debilitating disease. Safety. Well, this is an extremely safe procedure. So in the first 5,000 cases in our network, and we've had close to 10, there were only 2 complications, and none of them were related to stem cells. And both of them were done by the same person, and that same person was actually removed by the network. And basically, they were going outside of their scope. So any of the problems with stem cells had to do with the doctor doing something that they weren't trained to do. So doing an eye injection when they were not trained to do eye injections. Doing spinal injections when they were not trained to do spinal injections, and so on. So we want to stay within kind of our area of specialty. And that's why we all typically stay within like the orthopedic area and IV. If, someone needed an injection behind the eyeball, even though the docs like that we work with theoretically could learn how to do that, they just are not comfortable doing that, and we would farm that out to an eye doctor, an ophthalmologist, to do that kind of injection because they're used to doing those injections. So that's where the complications run in. You got to stay within your wheelhouse. If you take a procedure such as a knee replacement that has a pretty good track record, I'm pretty sure most of you out there have run into people that have had successful knee replacements, and you're looking at about only a 5% complication risk. Now, it doesn't mean that 95% of the people are pain-free. It just means that 95% of them didn't have major complications. So complications are usually follow-up surgeries, severe pain, obviously death, infection, things like that, loosening of hardware and components. So if you look at 5%, that would be 250 out of 5,000 cases. So as you can see, stem cells are extremely safe. Whether they're cells that come from someone else, like a donor tissue called an allograft tissue, that's sterilized through a very sterile process, or it's your own cells getting pulled out and pushed back in the same day. And that's an autologous procedure. So how many treatments are required? Well, depends on your condition. Most of the time, if you're coming in for arthritis, it's usually one and done. Occasionally, we'll do two. If you're coming in for a disc, it's the same type of thing. If you're coming in for, say, an autoimmune condition, we're not curing your autoimmune condition. We're not curing your Hashimoto's thyroid. We're not curing your lupus. We're not curing your multiple sclerosis. We're not curing your rheumatoid arthritis. So all we're doing is we're just buying time, turning back the hands of time. So we run an IV treatment, calms the immune system down, gives you new cells, and it just turns back the hands of time. And then if you manage your lifestyle appropriately, you could push it out quite a bit further. So we have some patients that could push their treatments out once every 3 years. Some people are bad, so it's once every year. And depending on that, it will be different types of cells, and we'll recommend specific things for your certain situation. Okay? And then obviously if it's a stroke or a brain injury, 90-day window, most of the time it's one and done. If it's more than that, it could be more than one treatment. So again, it's always a case-by-case basis, which is why I always recommend setting a phone consultation. Tell me about your specific situation, and I will let you know, or one of the other doctors that do the consultations will let you know, what your probable outcomes are. Who is not a candidate? Well, infection is one. So if you have an active infection, we'll just wait till you're done your round of antibiotics. So that's pretty much it. It's not that it's a problem. We always scoot on the low risk side of it. As far as cancer goes, if you're going through active chemo or radiation, we're going to wait till you're done your round. If you're just taking chemo pills, then, we've done that plenty of times before, and there's no problem starting you. So active chemo and radiation, and again, the best thing to do is to just set up a phone consultation, which you'll have a button to the side over there to schedule. You click, you schedule it, and let me know your specific situation, and we'll let you know if this is something you could move forward on or not even, and you have to hold off on. So pillar number 4, structure. So we have a lot of patients that come in. They've had these chronic problems for years, decades. They've had chronic knee pain, and they start walking bow-legged, where they'll look like a cowboy, or start walking knock-kneed, depending on where it's worn out in their joints, or they have an arthritic ankle and they start walking tilted or crooked. And a lot of these patients will have done physical therapy or chiropractic before working on their alignment and their muscle strength and their core strength, and they didn't really get the results that they hoped for. And I will usually recommend it after they get the procedure. And a lot of them are dumbfounded on the results they get after they had the stem cells. And it's not like it wasn't working before, but most of the time people are coming in because they had a chronic tear in a muscle, a ligament, meniscus, or like that cartilage is just worn down and they're getting close to the bone. So if you actually add new cartilage and you add that cushion, now the physical therapy or say the chiropractic alignment work or the massage therapy will make a difference. So that's why we always like structure. So, and if you're out of the area, we could give you a prescription and you could just find someone in your area that will fit the therapy model that we're looking for. And if you need help with this, we'll give you some recommendations. If you already have a therapist that you're comfortable working with in the area or a chiropractor that you're comfortable working in the area, we're happy to have you go back to them. The key thing is we need someone that's going to work on the muscles, someone that's going to work on the core strength, and someone that's going to work on the alignment. And as long as they do all three of those, then, we're fine sending you to anyone that does all three of those things. Stabilization, that's an important part, which we just alluded to, and that's going to be your standard traditional physical therapy.
Hi, my name is Tony Apolito. I injured my knee back in the 60s in a motorcycle accident, and over the years it got worse and worse. And I got to the point where I'm a golf teaching professional, and I could hardly do that anymore. And I came in here about a year ago to see Dr. Hashimoto, and I started with some other kind of injections, and that worked okay, but then I read about the stem cells, and I decided to do it, and that was only 3 weeks ago. And I can't tell you what a difference it's made. At least 50% difference right now. I played golf today. Normally I'd be pouring myself into the car and barely making it into the house, and I'm walking around perfectly right now. The pain is gone almost completely. It's like a miracle. It's the best thing I've ever done for myself. So I recommend it wholeheartedly.
Now that's Tony over there. He's done really well with the stem cells. Basically, he had a major knee accident and didn't want to undergo major surgery. He came into our office. We did all the traditional things with him. Cortisone, gel shots, physical therapy, laser, bracing, different things, and they helped to a certain degree, but he was really suffering from bone-on-bone things. We did the best we could through his insurance, and then basically he was at a point where he either had to get a total knee or do the stem cell, and he decided to do the stem cell. Did the stem cell. Right now, he's out of pain. He's doing quite well with his stem cell treatment. Other side benefits is that he had a age spot that he's had for well over 10 years. That went away. And like a lot of men, when we have the leftover stem cells, we run it through an IV. We have numerous men report to us that they're not urinating as much after they had the procedure. And they had an enlarged prostate. And, I don't know this for sure, but we've had this over and over again where they weren't urinating as much because the stem cells obviously went to that enlarged prostate and started to shrink it. Therefore, they weren't urinating as much in the night. He also noticed that his arthritic fingers weren't hurting anymore. So the stem cells will have a lot of side benefit. Most of the time, if we're doing it from the fat, we'll have a lot of leftover stuff, and we just typically will run it through an IV. We have some patients with the leftover stem cells. You could actually pop them in the top of your head to grow hair. You could actually do stem cells on the face to kind of regrow collagen, skin, fat, and the fibroblast layer to give it a more youthful look. So it just kind of depends on the patient. So we have some that want more wellness and they run it through an IV. We have some that want more of the aesthetic side of it and they just want to grow hair or, work on the wrinkles on their face. So to each their own. We give the patients an option with the leftover stuff, and some people will just choose to freeze it. Just if you freeze the stem cells, you're going to there's a third party that freezes it that has nothing to do with us, and there's a fee for that. So most of the patients will choose for it to get it deployed immediately onto their body or into their body.
So I'm 8 weeks. I'm 8 weeks into my stem cell, and it's been remarkable. I find that I'm able to play golf, whereas I wasn't able to even flex my knee before, and I would recommend it to almost anybody.
So here's Barry. Barry's done really well. I actually saw him at close to the 1 year point just recently. Pain's gone in the shoulder, pain's gone in the knee. He's lost a bunch of weight because his knee pain was gone. He was exercising more. Then after he started exercising more, he decided that he's going to start eating better, and he just started losing a lot of weight. And, it's just really changed his life. And he just never wanted to go down that surgical path and wasn't ready to give up golfing yet. So fortunately for him, he could continue golfing. And now that he's healthier, he's just going to be on this planet a lot longer. So now for some question and answers. So first thing I'm going to answer before I kind of get into this is you do not have to physically come into the office to become a patient in our office. We treat a lot of people out of state, out of country. We've done a couple of patients from Europe. We've done numerous ones from Canada, a number of physicians from Canada that just wanted this procedure done because they can't quite do it the same up there yet. And then we've had a number of other Canadians. So a lot of times we'll just start with a phone consultation. It'll be from a webinar just like you've seen right here. So I have a list of questions that my assistant has been kind of feeding me over here. And I thought I answered this earlier, but someone asked, does it work for arthritis? Yes, it works for arthritis, osteoarthritis, the kind from wear and tear is the most common one. It'll also work for psoriatic arthritis. It will work for rheumatoid arthritis. It will work for gouty arthritis. It will work for virtually any kind of arthritis. So if you have arthritis and you have pain in your joints, tendons, or ligaments, and you don't want surgery, this may be the option for you. The best thing to do is to get us a copy of your X-ray, CT, or MRI, just the report, and get it into the office before your phone consultation so we could be very efficient with your time. And I will let you know if it's past the point of no return and not even worth pursuing, or if it's something that probably would require, more research or maybe a newer scan on. But it just starts the process. Another question that I had is, yes, it works for bone-on-bone knee pain. I've answered that earlier, but yes, it does work for bone-on-bone. We've done bone-on-bone hips, knees, backs. Everyone responds differently. We've had great results from people in their mid-90s. We've had moderate results from people in their 50s. There's some patients just respond better. We've gotten really good at predicting outcomes. We could usually tell you, within like 10 to 20% of where you're going to be. And, it's just from experience and doing this for a long time, we've just gotten pretty good at just kind of giving you a pretty good idea of what kind of results that you're going to get. Okay, one of the other questions is why wouldn't we use umbilical cord all the time since those are newer, younger cells? So when it comes to stem cells, we look at really two things. We look at how many there are and how viable it is. Because over here in the US, we have adult mesenchymal stem cells. So whether it's cord blood, placenta, bone marrow, or fat, that's going to be an adult mesenchymal stem cell. So we're just looking at pure number-wise. And pure number-wise, cord blood and fat are going to be a higher concentration one. However, like I said earlier, the FDA requires that sterilization process with the cord blood. Decreases some of the viability right there. Gamma radiation kills all the viability. And then you got to freeze it and ship it off. That will decrease some of the viability right there. Viability is kind of how active the stem cell is. So like I said, stem cells are the construction workers. So more workers, more construction. Viability is how energetic that construction worker is. Did they get a good night's sleep? Are they lethargic? Are they energetic, in shape, and can build a lot of stuff? So we're looking at viability and we're looking at quantity. And that's pretty much it. And the source does matter. And that's why we don't use bone marrow in our practice. Nothing against bone marrow. Unless you're growing it in a lab, it's, you're just going to have a lot less. And most of our patients are 50 to 90, and it's just not really a good option for them, which is why we'll typically use umbilical cord, amniotic, placenta, and fat. And that means that we're doing everything under the sun other than bone marrow. So, autoimmune condition. Someone asked about autoimmune. Basically, if you have an autoimmune condition, odds are you're going to have some improvement with it, and we're going to use fat. If you have multiple sclerosis, typically we're going to do that spinal, and then we're going to run it through the IV. If you're adverse against doing the spine, we could run it through the IV. Wouldn't recommend it because we want as much of it going to the brain and spinal cord as we can. If you're coming in with spine, depending on, it's not a flat yes or no question. It's not a black and white case. So sometimes we may do a diagnostic injection with like just a short acting painkiller in advance. Sometimes we may do that just right before we do the procedure just to make sure that we're getting it into the right spot. So we don't have a set way of doing it. It really just depends on your exam findings and your studies, your CT, your X-ray, your SPECT scan, your MRI, and things like that. And that's why we always start with that preliminary phone consultation, and that's why it's really good to have that information ready for us before we get on the phone. So you get one free phone consultation, so I'd advise you to just, make sure it's a productive one. Safety. Well, this procedure is extremely safe. That's one thing that we do know. Results vary depending on the type of stem cell and if you're deploying it in the right area. That's pretty much it. But as far as safety goes, it's extremely safe. And I had one other question that I want to answer. So someone asked, is this an FDA-approved procedure? And it is not. But there's no such thing as an FDA-approved procedure. No one has an FDA. There's no such thing as a FDA-approved arthroscopic surgery, FDA-approved ACL replacement. So the FDA regulates drugs and devices, and that's it. So they will regulate a sterilization process of that donor tissue from the placenta and umbilical cord, but they don't regulate the actual procedure. So this is an autologous procedure, which is technically a minor surgery. Just like if you have an ACL tear in your knee, you could pull out some tendon off of your hamstring and place it into the knee. Pull it out and then put it back in. And that's an autologous procedure. So this is not FDA approved. And it's never, until it becomes a drug, it's not going to be FDA approved. But as far as safety goes, it's a very safe procedure. So if they later classify this as a drug, then yeah, you have FDA-approved stem cells. But until they call it a drug, it's not going to be totally regulated by the FDA. So again, some of you may be feeling like you drank out of a fire hose, and I just gave you a lot of information right here. And you may be wondering how to turn today's information into a better life with less disease and less pain. Well, I went over our stem cell treatment protocol, and you understand why it can be complex. And it's not simple. We have a 5-step system of proper diagnosis, viable stem cells, proper deployment, post-op follow-up with diet, laser, and red light therapy, and then structural treatment when necessary. So here's what you're going to get. Because I want some of you to take advantage of this. And if you're sitting on the fence, get off the fence and click the button over to the side and schedule that phone consultation. So you're going to get a 10-minute phone consultation. Prior to the phone consultation, I would highly appreciate getting a report of your x-rays, MRI, CT scan, SPECT, S-P-E-C-T, or CT scan before we do that. Anyone that schedules this phone consultation today is going to get 9 laser treatments or a stem cell light rental at no charge when you book your stem cell procedure. You're going to get a recommendation of the type of stem cells. And obviously, if your insurance covers your therapy, physical therapy, we'll make sure that we refer you to a provider that takes it. Obviously, if you're in the area and it's realistic for you to come to our office, we'd love to do the therapy in our office. But we do these webinars all over the place, and you could be watching anywhere. So we're going to send you to wherever it's most convenient. And the last thing I forgot to mention over here is anyone that books a free 10-minute phone consultation is going to get a copy of our stem cell book mailed to you at no charge. No catch, no hooks, no strings, nothing. So you're going to get the book free of charge. Basically, all we need is a mailing address, and we'll mail it to you. We're also offering this offer for today and today only because I reward action takers. And if you want to get better, the sooner you take action, the more likely you're going to have better results. Unfortunately, if you let this go on for too long, it might actually become too late for you to get a result. So we've had patients that have had pain for 30 to 40 years. And those definitely aren't as easy as 5 to 10 years. So I am rewarding you for taking action on this today. As far as guarantees go, there's no guarantees in anything other than death and taxes. No guarantees of any medical procedure. I will guarantee you that nothing will happen if you don't book an appointment and take it to the next step. So the first thing you need to do is click the link and then schedule that appointment, because we want you to avoid major back surgery. We want you to be running at the beach with your kids and grandkids, picking up your grandkid and not having pain, running down the beach, living life on your terms, not being a spectator, going on that family vacation, that family hike, and doing the things that you want to do because you choose to and not because you have to. As far as costs go and what insurance covers and doesn't cover, insurance doesn't cover stem cell therapy, but insurance will cover a number of other things. And the best place to start is with a free phone consult, because we have some procedures that are in the hundreds and some that are in the thousands. Therefore, it's hard for me to make a blanket statement to cover every single person. So what I'm going to recommend is that you just schedule a free phone consult, and we could talk about your specific situation then. Should you take action now? Yes, I think you should take action now. And like I actually mentioned before, guarantees. Well, here's a guarantee for you. I guarantee you that if you do nothing, it's only going to get worse. And that's pretty much it. Stem cells do seem like they can help a lot of things, and I wish that they could cure every type of disease, but they can't. And even though I understand that they can't do everything for you, they've helped a lot of patients get out of pain, get back to their lives, and just give them freedom. We've had a lot of patients erupt into tears after their pain was finally gone because it's changed their lives. And stem cells may or may not be the answer to your prayers. However, I think it would be an absolute shame if you passed up on this life-changing procedure because you weren't sure if this was right for you, and we were the solution to your prayers. So it may or may not help you, but you will never know unless you take it the next step and click on the link and schedule that phone consultation. So I'd love to answer all your questions then. This is Dr. H signing off. Look forward to talking to you soon on the phone.